Welcome back, everyone. You know, experts are saying that across the nation, doctors are seeing an increase of younger people coming to them with heart problems and questions. Well, to figure out what doctors are experiencing in East Tennessee, we have cardiologist Dr. Emmanuel Isang from UT Medical Center. Thank you so much for coming in.
Thank you.
First of all, here's the question. What are you seeing here with your patients?
So once again, thank you for giving me this opportunity.
Yeah.
One of the biggest things that we're seeing is that overall, we're seeing a lot of people coming in general, whether that's the younger people or even the older individuals. And when you have such an enormous amount of people coming in, you're going to get younger people in general with that too.
Mm-hmm.
People are a lot more health aware now. They have more health awareness, which is an amazing thing. They want to get checked out. This is one of the things that we've been preaching for them to, if you're having any symptoms of chest pain or shortness of breath, get checked out. And because of that, we're seeing a lot of more people coming in, including younger individuals.
So you're saying it may not be problems, it's more awareness that you feel a little different. You may have, like you said, chest pain or something else. It's wise to come see you.
Absolutely. You know, there are some things that we can control, such as your weight, such as your blood pressure. You can't control your genetics. So unfortunately, over the past few years, we've seen people who are more sedentary, who are living at home, whose jobs are at home now, and because of that, less activity, putting themselves more at risk of having heart disease. And from that, from the knowledge, from just awareness, they're coming into the hospital more.
Yeah, it's tough when you're working remotely to make yourself get up and go run.
Absolutely.
Or whatever you need to do. What do you recommend for people just to maintain that as healthy a lifestyle as possible for their heart health?
Absolutely. So our biggest recommendation exercise-wise is 30 to 50 minutes a session for 3 to 5 sessions a week. I'll go a little bit further saying that if you can't allot that amount of time, if you can only do 10 to 15 minutes, do 10 to 15 minutes, but more importantly, be consistent with it. Watch what you're eating, the DASH diet or the Mediterranean diet, which focuses on less meats, more fruits, more vegetables.
All right, very good. Thank you so much for coming in. We appreciate it. Listen to the doctor, everyone.